Welcome to Local Community Advocacy, advocating for the needs of LGBTQ+ older adults receiving aging services, a presentation developed by the National Resource Center on LGBTQ+ aging. We hope that this presentation inspires you to use your voice and gives you practical ideas about how to advocate for LGBTQ+ older adults within local aging services in your community. Your willingness to be here is the first step toward creating spaces where LGBTQ+ people feel welcomed and affirmed. Throughout this presentation, you will hear the acronyms LGBT, LGBTQ, and LGBTQ+, or the phrase, the community, used to describe the lesbian, gay, bisexual, transgender, and queer/questioning expansive communities. The different acronyms have come about over time as language has evolved in the community. The National Resource Center encourages you to use the language reflected by the LGBTQ+ person you are working with. SAGE's National Resource Center on LGBTQ+ aging is the country's first and only technical assistance resource center aimed at improving the quality of services and supports offered to older adult lesbian, gay, bisexual, transgender, and queer/questioning expansive communities or LGBTQ+. The National Resource Center offers both in-person and online webinar trainings meant to assist you in learning the best ways to create an inclusive, safe, and welcoming environment for your LGBTQ+ older adult population. For more information, you can visit www.lgbtagingcenter.org. The goal of today's presentation is to prepare you to become an advocate for LGBTQ+ older adults in your community. This presentation will consist of 3 parts. First, we will introduce the concept of community advocacy for LGBTQ+ older adults. Then we will talk about various ways that you can get involved in advocacy for LGBTQ+ older adults in your community. Lastly, the presentation will end with 3 action steps for you to start your own community advocacy journey. Now, we will discuss a brief introduction to community advocacy. Slide 4. Introduction to community advocacy. Advocacy happens at the national, state, and local level. There is no better person than you to advocate for LGBTQ+ older adults in your own community. You can use your voice to advocate for LGBTQ+ older adults that might be reluctant to use aging services because of a fear of discrimination. Getting involved in your local aging services as a volunteer can make a world of difference for the inclusion of LGBTQ+ older adults in your community. Now, we will discuss important information about local aging services in your community. Local aging services across the country were established by the Older Americans Act of 1965 and are funded by this piece of legislation along with state, local, and Medicare and Medicaid funding. Aging services primarily serve people ages 60 and older, as well as those age 18 to 59 who have disabilities. Aging services cover a range of different needs, such as employment, long-term care advocacy, adult protection, nutrition, transportation, care partner services, legal services, benefit enrollment services, support for those living in their homes, and information assistance and case management. Next, we will discuss how these programs are administered. All states are required to publicly share a state plan on aging to describe how they will implement aging programs in their state. This is a good resource for learning about how aging programs are administered in your community. You can access your State Plan on Aging online by Googling the Advancing States map of state plans on aging, and from there you can access your state's plan. These are important to review because they indicate if local aging services are committed to helping LGBTQ+ older adults. Now, we will discuss how you can become an advocate in your community. One of the most important ways that you can advocate for LGBTQ+ older adults is by becoming a volunteer and contacting your local aging network or age-friendly community. Becoming a volunteer that identifies as LGBTQ+ or as an ally provides an opportunity to educate and advocate for LGBTQ+ welcoming services at the organization with which you are volunteering. Volunteering as an ombudsman, an advocate for residents of long-term care, is also a great way to be an ally for LGBTQ+ people. Many people who identify as LGBTQ+ might delay entering long-term care or getting services from the aging network for fear of discrimination, and your presence as a volunteer might make a world of difference for an LGBTQ+ older adult in your community. Another way to get involved in advocacy for LGBTQ+ older adults in your community is by getting involved in your local Aging Advisory Council as someone that identifies as LGBTQ+ or as an ally. Local aging advisory councils advise area agencies on aging about the best ways to implement state plans on aging. Advisory councils are required to be comprised of members that represent those who identify as minority older adults, as well as those that identify as allies of minority older adults. LGBTQ+ older adults and their allies joining aging advisory councils help meet the requirement for representation of minority older adults. Area agencies on aging need your help to meet the state requirements, so LGBTQ+ individuals and their representatives should be welcome additions to the council. You can get involved by contacting your area agency on aging. We will conclude this presentation by providing 3 community advocacy action steps for you to take forward into your community. First, do your homework by looking into the state plan on aging and the area plan on aging to see if LGBTQ+ people are included in the goals, objectives, and strategies, or are defined as a population of greatest social need. Research local area agencies on aging, senior centers, and ombudsman programs to see if they are inclusive of LGBTQ+ older adults. Next, be part of the solution after doing research. Get involved in advocating for LGBTQ+ older adults to be included and represented in aging programs by becoming a volunteer, connecting local aging networks with the Sage Care Credentialing Program, connecting long-term care facilities with the Long-Term Care Equality Index, or getting involved as a representative from or for the LGBTQ+ older adult community in aging advisory councils. Lastly, be flexible and patient. National efforts are underway to improve the treatment of LGBTQ+ older adults in the aging network, but it can make a huge difference for people to take action in their own communities and begin working with their local aging network by volunteering or suggesting smaller outreach initiatives. Now that we have discussed the ways that you can advocate for LGBTQ+ older adults in your community, we will offer a reflection question for you to take with you. What are some steps you or your organization can take to get involved in advocacy in your community? In the short term? And in the long term? We hope that this presentation has helped you think about some answers to this question and some ways that you can get involved in local community advocacy for your LGBTQ+ older adult peers. If you want to learn more about local community advocacy, the information provided in this presentation is given in more detail in the toolkit entitled Local Community Advocacy, which is available for download on the National Resource Center for LGBTQ+ Aging's website, lgbtagingcenter.org/community advocacy. If you or your organization are interested in recommending a more in-depth training and credentialing to an aging service provider in your community, Sage Care offers training and credentialing for aging service providers on working with LGBTQ+ older adults. You can go to sagecare.org to learn more. Thank you for attending this presentation on local community advocacy. You can get more information about community advocacy by going to the website for the National Resource Center on LGBTQ+ Aging, lgbtagingcenter.org. If you are interested in sharing this presentation with others, you can sign up to be a volunteer ambassador with the National Resource Center on LGBTQ+ Aging by going to the same website, lgbtagingcenter.org.